Hello, Assalamualaikum semua dan salam sejahtera. My name is Zaman from AGC, and today I would like to present about learning and systems theories. Let's begin. Now let me begin with introduction. The most crucial elements in occupational therapy are theories that integrate concepts about people and more. Learning is the gaining of knowledge and more through experience that leads to a complete change in behavior and performance. Learning theories include behavioral theories, cognitive and more. And this type of learning and system theories will be discussed here more. Let's proceed. Now, let us go to behavioral theories. The simplest explanation of behavioral change has been described by Edward Thorndike as the association between behavior and the resulting reward or punishment. B.F. Skinner, a renowned psychologist, believed that the environment shapes all human behaviors and that behaviors may randomly be emitted in response to an environmental stimulus or stimuli. The mechanism which influences the environment to shape behavior is known as contingency of behavior, in which includes stimulus situations, behavioral response, and environmental consequences. Skinner's concept has been widely accepted yang masuk diterima in intervention for children, also known as therapy, which is known as operant learning. And Skinner also believed that all behavior is a result of the environmental control of the individual, culture, and species. He also states that humans, species, and culture are all one part of the environment, and hence so they can control as much as they are being controlled. The human have the freedom to do that. Detailed research has decided that when specific behaviors result in consistent consequences, these behaviors can be altered or modified. Behavioral therapists can assist a child to achieve a higher performance level through shaping process, which involves breaking down a complex behavior into simple components and reinforcing each behavior individually, separately asingkan, and systematically till it reaches the desired behavior. And applied behavioral interventions usually use operant condition in highly controlled environment, in which therapists give the child instruction arahan and then reward the child for a proper response. And applied behavioral interventions are successful developing skills, but skills learned in an isolated setting don't always generalize into higher level behaviors across all settings. And behavioral approaches which uses operant learning are implemented in the child's natural environment to teach children the adaptive behaviors that generalize across environments secara umum. And early childhood teachers have advocated for naturalistic teaching methods that can be applied in the minimally structured sessions in various locations with a variety of stimuli. Now coming to the shaping techniques. Inside the behavioral, there's a technique called shaping techniques, and here I'm going to explain about the examples. Shaping is a systematic process of progressive acquisition of a new behavior and through performance of successive acts that collectively represent a more advanced skills. There are actually three shaping steps which are taken by interventionists or therapists. Number one is defines behavior as a series of incremental steps. Number two is prompts the child to show the steps, and number three is to reward each successive skill achievement. And shaping is appropriate for multi-component skills that have a developmental progression in which the skills can be developed, divided into steps, and the progression in performance can be elicited. And in incidental teaching, a play environment is created to stimulate the young child's interest and curiosity. The goal is for the child to select an activity and spontaneously starts to play randomly without any prompt. Pivotal response training is also an example of naturalistic teaching and learning approach used with young children, especially below 12 years old. The goal of this technique is to teach children a set of pivotal behaviors which are central to learning. There are several desired outcomes from this technique, which number one I can say is raising the child's desire to learn, to make the child to minat belajar lah. Tentu lepas tu attention to learning tasks, so supaya boleh fokus. Lepas tu persistence in tasks, and also interaction initiation, and also to have a positive effect. Now, coming to the social cognitive theories. In general, this theory states that learning occurs in a social context. This theory, which were proposed by Albert Bandura and John Piaget, who are two well-known psychologists, stated that children can learn by observing other people's behavior. In contrast to behaviorists who believe that all learning creates behavioral changes, social cognitive theories state that learning can happen without observable behavioral changes. In this theory, people regulate their own learning by seeking certain experiences and focusing on their own goals. In social cognitive theory stated that children learn indirectly by observing how their peers' behavior are rewarded or punished. When learning new behaviors, direct reinforcement is not necessary, is not needed, such as when the child learns by observing the behaviors or consequences of others. Social cognitive learning is often indirect, usually. In this theory, children gain social skills through group experiences. Albert Bandura stated that critical factors in a child affects the learning process, which includes the child's perception of his or her competencies. Now, coming to the final part of this topic, which is the influence of motivation and self-efficacy on learning. Efficacy. Several factors are said to influence learning, such as cognition, motivation, attitude, and self-perception. The connection between learning and other affective components is very complex. It's not very simple. It is stated that children's desire to perform tasks is influenced by efficacy perception, regardless of whether these perceptions are correct or wrong. So there's no jawapan betul atau salah macam tu. If children experience success in learning situations, it is assumed that their perceived competence increase, and also the internal control gain support from significant others, and show pleasure in mastering the task is also increased. Motivation to learn and achieve is developed through three ways, tiga cara. Contohnya casual attributions, outcome expectancy, and personal goals. Self-efficacy beliefs contribute to motivation in various ways, such as determine the goals people set for themselves, how much effort they expend, and more. All these decisions contribute to success in a specific goal and also contribute to learning. Interventionists or therapists need to realize the significance of providing successful learning chances and optional learning situations. It is also very important to note that young children may not have the metacognitive awareness. This metacognitive awareness, and which are required to compare their own performance accurately against that of others. This awareness limitation may have an adaptive purpose in childhood. As children develop, their competence expectation becomes more specific to the type of task and is influenced by their prior experience with that task and more. And I would like to tell thank you to everyone and hope to see you again.